This is Hard Rhythm TV. I'm Juan Carlos Zerpa. We are at the FHRS 2025 meeting in San Diego, and we had a great session of global initiative in sudden cardiac death awareness that was organized by the global EP leaders, and I'm joined today by two of my colleagues, global EP leaders from North America, Dr. Andrew Krahn, welcome.
Thank you.
And from Africa, Dr. Mervat Aboulmaaty, welcome again.
Welcome. How are you?
It's always a pleasure to have you both here in the FHRS TV. And I want to know about you, about the highlights of the global initiative of sudden cardiac death awareness. We have this session yesterday, and it was really important the way we try to understand the importance of trying to prevent sudden cardiac death and how this affects all the continents, because we put all the whole globe together in one place.
Yes. This global meeting brought us together from different continents on the same aim to prevent sudden cardiac death, and also to give awareness for the people who have one member, how to deal with the other members. We listened to many conversations and presentations from all different continents. And me presenting Africa, I presented the dark part of the situation where the investigations, the genetic testing, the medication, even the diagnosis is missing in this part. But at the end of the meeting, we listened to the European, the American, and all the nice stuff to reach and to incorporate and also to use, like using the iPhones and the AED, the flying aeroplanes, the drones, and also to communicate with other societies through WhatsApp. Simple, in order to build up this awareness and treatment and then prevention of others who are susceptible to sudden death.
Dr. Andrew, you just presented a particular case, clinical case, that having all the tools is really a difficult way to treat or to prevent sudden cardiac death.
Yeah, I think, one step back comment is about 1 out of 1,000 people die suddenly every year. So this is the biggest chunk of deaths in all societies. So that's why coming together like this is so important. I think the second thing that we heard is, we heard everything from situations where there aren't emergency response people to even recognize if somebody calls for help, there's no one to call, to areas where they have automated systems for people to come with notification and drone AEDs, and exciting is notifying people to go and deliver CPR and use the AED because the ambulance can take too long to get there. And we heard some places, including in your continent, where the time for the ambulance to get there can be an hour.
Yes.
Which means it's for a burial, not for a resuscitation. So, the case that I chose to present was one where there were warning signs and the context was not recognized as dangerous. And then a tragedy happened. And then the family that's left behind of a young man with parents and children and relatives and so on illustrates it's more than the individual, it's also the whole family. And that should rally us around the idea of recognition and prevention of this. I think the most exciting part of what we talked about yesterday was the idea that we need to also connect with the resuscitation community, because in most places it's actually not run by a heart rhythm specialist, it's emergency or primary care type of people. And so those are connections and bridges that we need to build so that we can exert our expertise. We're very good at this, but only when they get to us.
Maybe electrophysiologists are not the end of the chain. We have to be together in the beginning of the chain with prevention, education as well with that. Sure. Any other comments?
Yes, we should make like a sub-speciality of our society who are involved in how to build up CPR all over the continent for lay people, for everybody. And then as was mentioned in the Japanese presentation, that teaching in schools, in primary schools, in this resuscitation, this will help to save people, maybe the teacher, maybe the father, as we saw in the presentation of some colleagues. So it's awareness, education, and also preparation for the next step. So, okay, he resisted him and then he goes to the hospital, should receive the proper treatment. So this goes to the level of emergency doctors, cardiologists, electrophysiologists, because we are at the end of the line. So we should be in the first step to jump into this and to take this responsibility as societies.
We were talking about the fast response, recognizing the cardiac arrest and fast response. And we have so many AADs available, but maybe the population doesn't know how to use it
Yes.
and how these affect even the chain, because you have the tool to abort the sudden cardiac death, but you cannot deliver the treatment the right way to have the better results.
I think getting your driving license or your ID
That was a great idea.
in our country, you should have a certificate of CPR. And also for AED use, after implanting these AEDs in public places, which is not in my country, but actually some governments will become aware of this when one of their relatives dies and does not get proper resuscitation, then he is going to do something.
We also saw that the ICD usage and implantation in Asia is kind of different that we do it here in America and in Europe, right?
Yes, yes. In the era book, they compared what we do in Africa, like Egypt, Morocco, Algeria, and actually you are in the lowest percentile. So
Yeah, I think one of the interesting things I heard yesterday was that nurses do much better CPR than doctors, but it illustrates the fact it's a teachable skill and it should be directed towards as many people as possible. So I know in Canada, for example, there are several jurisdictions where now it will be you will not be able to graduate from school without being certified in CPR. And that then creates such a pool of first responders. And then these apps that say, a person has had a cardiac arrest, here are the directions to run there. Very exciting when there's people who can actually have the skills to help. So I'm optimistic we'll have more patients to keep alive if we can get them to survive the index event.
there was also a nice point about a resuscitation for women, because they have to take off their clothes. And a boy in the school, he invented this jacket.
Yeah,
In Japan. In Japan, yes.
very.
To deliver herself while the woman is covered. So this may be applicable in our continent
Yeah.
for covered women.
It's important, yes, about the patient all the time.
Yes.
And sometimes we don't get to recover a patient and death happens. What are we doing to get everybody together in the same level? Because we manage this from different. Canada have a structured way to treat this and to manage this investigation after it happens, trying to approach to families and all this stuff. But we learn about it, that education helps other countries and other continents to get in the same level.
And I think one of the things that it's a little bit like the resuscitation part of things. When you think of, you need a coroner, a pathologist, a person who usually connects with the family and sometimes the primary care physician, and then a referral to an expert center to manage it. And then the potential to access materials to do genetic testing, as an example. So again, those aren't people who are in the same circle very often. It has to be created, right? And so often what happens is, sadly, I sometimes will see a family where the second death led to it coming forward for evaluation. It's so tragic, but it illustrates the fact that there was a missed opportunity. And so some of it, again, we go back to, if you have a relative who dies suddenly, does the public know to ask for help or call for help? Or does the health system say, your brother may have died of something that's inherited, you should be evaluated? And so again, we have internal work to do to build the content experts, and we have external work to have the population understand they should be seeking help.
So we know as early recognition,
Yes.
treating appropriately, and know what to do after when it
Yes.
is happening.
And also reaching the maximum of treatment, like ICD. Don't tell the family, okay, this is inherited cardiomyopathy and your son should receive an ICD. But we don't have this service, can't. So we have to have it to the end And I think we should talk to governments and to Ministry of Health as a society and tell them this is a big issue. We have a plan to do so and so and so. Maybe one we will talk several times until we put it in action. Because if we talk to one another, what is going to happen? No change. So we have to take this as a guideline or a policy and send it to the societies, send it to the governments, send it to the Ministry of Health in every country and tell them this is serious and this is the pathway to be.
As a global initiative, we know that every country has its own issues.
Yes.
In the continent, it's different, it's complicated to put everybody in the same level. But imagine in a global situation as we did yesterday, that trying to find a global view of the whole situation.
Yes.
We have so many differences. These kind of sessions that put together a lot of experts in this team from all around the world help us to improve the results, improve the way we do the things.
But we have to come out with recommendations, and it will be a responsibility to deliver it to the Ministry of Health and to the my government and to the Society of Cardiology to apply. At least they listened to what they should listen to.
What did you learn from the summit?
I love the summit. I love to be in global situation so that I see the future of what I should do. And I see the situation, so I have hope. This gives me hope. I'll be better.
Dr. Andrew?
I was actually quite inspired by the possibility that in our digital world, because so many people have phones or smartwatches, our digital world can be part of sudden death recognition, resuscitation, and management, to communicate information, to call for help, to summon CPR people and so on. And I thought, there's hope, because our ICDs really are very reactive to a tiny group of people, that the population needs the help to keep it from happening in the first place, right?
And this was the first time that as the FHRS meeting put this session together with pediatrics, clinicians, cardiologists, and even ICU.
Yeah.
Right? The whole chain together. It was a great exchange of information. It was an honor and a pleasure to have you all here.
Thank you. Thank you. Yeah, and thank you very much, JC, for hosting us.
No, it's always a pleasure.
Yes.
And it's always a pleasure to be in Heart Rhythm TV as well. Thank you so much for watching.